back to health care for a second, because I think that this was an important debate, speaking of Lou Dobbs, that Bernie Sanders and Orrin Hatch had on Lou Dobbs' program on CNN. Now, it's important because normally what Orrin Hatch says is what gets said on television and no one ever challenges it. In this case, we had Bernie Sanders actually challenging it and fighting him step by step. And it almost felt weird to have someone who's saying the truth on television allowed to fight back. And that's why it's a great thing to have Senator Bernie Sanders be a senator. And here he is on Lou Dobbs.
Well, I don't know. I'd be surprised if they can put together a program that could be supported by Republicans, because they're pushing for, you know, more taxes, more government, and more spending. And I just don't see how you solve the problem of the $2.5 trillion current bill by adding another $1.5 to $2.5 trillion more. But I know they've had a very difficult time because of that government plan approach.
Well, I'm not quite sure where Senator Hatch is coming up with those numbers. What I do know is it concerns me less whether we do it today or tomorrow or a year from now. What's most important is that we do it right. And Lou, we have a major crisis in this country, and it's not only that tens of millions of people are uninsured or underinsured. We've got over 18,000 people every single year die. They die because they don't get to a doctor when they should. We got 1 million people this year who are going to go bankrupt because of the very, very high cost of health care. So I think doing nothing is not an option, but my main point is we've got to get it right. That's much more important whether it's done tomorrow, next week, or 4 months from now.
Senator Hatch, your reaction to that?
Well, I think we do have to get it right, but I don't think getting it right is expanding the federal government. They want us now set up a board of 5 people, or a panel of 5 people, nameless, faceless bureaucrats, to determine how to ration health care, because that's the only way they're going to save money the way they're going. Otherwise, we're moving right straight to everything the Democrats are asking for, at least the liberal Democrats are asking for, would lead us to a single-payer system, or in other words, socialized medicine.
Well, first of all, a single-payer system is not socialized medicine. Medicare is a single-payer system. And I would argue that most Americans feel a lot better about Medicare than they do about private health insurance companies who throw them off of health care if they have a pre-existing condition or if they got sick the preceding year, whose CEOs have enormous salaries and compensation packages, whose administrative costs. You know, Lou, we have got to ask ourselves why in the United States we are spending almost twice as much as any other major country on earth, and our health care outcomes in most cases are not as good. And
part of it is because of government run. The Medicare system is $39 trillion in unfunded debt. Now we're going to turn the rest of our health care system over to the federal government. Not on my watch. You're not going to.
No, that's just not accurate. I think when anyone will
sure,
tell
it's
you
accurate.
No, it's not accurate. Medicare, you know, if you're looking at the average person out there, their health insurance costs have doubled in recent years. What we're looking at is 1,300 private health insurance companies who have thousands of plans. In the last few years, the last couple of decades, what we have seen for every new doctor that's come on board, we need doctors, we have 25 healthcare bureaucrats. And people all over this country know how hard it is to get the health insurance companies to pay them what they're supposed to be paying.
And the worst health care bureaucrats that we have are the government health care bureaucrats.
I don't think so.
They're running this system into the ground. And to be honest with you, anybody who believes that the federal government is going to do better than the private health insurance competitive system is wrong. Now, let me just make one other point. We have 300 million people in this country. But they claim 47 million are not covered by health insurance. Now, let's just be honest about it. An awful lot of those people are people who could afford it but won't get it. Some qualify for the CHIP bill, or some qualify for Medicaid right now. Look, Bernie, I have a lot of respect for you, but come on, you know the doggone federal government is half the problem here.
Well, is that right? Well, then you go back and you tell veterans in this country that we should disband the Veterans Administration, which is 100% government run. Is that your suggestion?
I'm not telling them that. I admit that there are things.
Wait a minute. That's a government-run program.
Well,
there are things. Disband Medicare.
There are things government can do. I don't think they're doing it as well as they should do. But to throw over the whole private sector approach that is competitive, to throw it over so that we can have a bunch of bureaucrats, nameless faceless bureaucrats, get in between your doctor and you, it just isn't right.
First of all, nobody is talking about that. What people are talking about
I'm talking about it.
Well, but we're talking, nobody's talking about a government-run healthcare system. We're talking
Well,
about...
sure they are.
No, they're not. They're talking about a public option.
What do you call the public plan? What do you call that?
A public option that will compete and give people the choice of whether they want a public plan or a private plan. Why are you afraid of that? If the private plans are so much better, people will go into the private plans. If the public plans are more cost-effective, more reasonable, people prefer a Medicare-type program, they'll go into that. Why are you afraid of the competition?
Not afraid at all. It's just that we know that there would be unfair competition because the federal government has unlimited funds to be able to carry on whatever it wants to carry on, and it wouldn't take long. Well, the companies have to pay taxes. They have to meet certain state and federal standards. They got all kinds of other things they have to do, but they can do it better than the government.
This is a level playing field, and I think it's interesting that the health insurance people who are spending $1 million a day lobbying Congress, putting huge amounts of money into campaign contributions, are afraid of that competition. I think that the American people are sick and tired of the private health insurance companies who have been ripping them off for years, and they want to see some competition.
Man, I love Bernie Sanders. When he told Orrin Hatch that's not accurate, basically not true, I was like, it's been so long of Democrats bowing their heads on television that I was like, is that allowed? Can you tell the venerable Orrin Hatch that he's full of crap on TV? And I love I mean, it's Young Turks 101 where he's like, oh, so you want to get rid of Medicare? You want it? Oh, no, you don't, huh? You want to get rid of Veterans Affairs? You want to tell the veterans that we're not giving them government-run health care anymore? He's like, all right, then why don't you drink this tall glass of shut-up juice? And what did Orrin Hatch say? Well, I mean, the government can do some things. Well, if the government can run Medicare better, you think, and you think the government can run health care for veterans better, why can't it provide a public option that might be better than the private insurance? And at the end, Bernie Sanders explains the real reason. Now, he didn't go as far as I would have, right? He says it's because these lobbyists pay the politicians to say these things. Now, if it was me, I'd say, Orrin, you know how much money you're getting from the healthcare industry? And you think that might have something to do with you saying, oh, no, nameless, faceless bureaucrats getting between you and your doctor. I got that from the OMI poll that we commissioned earlier. And why do they have to be nameless and faceless? Could you imagine you actually run into them, the dude has no face, and name tag blank? Okay, no, they're going to be guys that make the decision, like there are guys that make the decision in private insurance. No, I'm sorry, Mr. Jackson, you cannot get that procedure. I'm sorry, Ms. Johnson, you cannot get that procedure. That happens all the time in private insurance. Are they nameless and faceless, or do they get to have names and faces? Okay. And finally, again, if it was me, I'd say, look, you don't think the government can run anything, right? That's why you're like, oh, these government bureaucrats, yeah. You see that little smug look that Orrin Hatch has? He's like, and what's the worst of all? The government bureaucrats. Imagine the government running anything better than the private industry. Okay, yeah, I can imagine it. It's called the United States Armed Forces. Are you denigrating the troops? Is that what you're doing? Because that's what it sounds like to me. You know what the government runs? Fire department, police department, the United States military. Are you talking against those people? Is that what you're doing, Orrin? Because that's what it sounds like to me. And by the way, if you're asked in a fire, my guess is you're going to scream, government, government, help me, please. All right, now, but as it stands, I think Bernie Sanders did a great job, and I'll take it, man. I'll take it. And finally, a little bit of truth on television. Watch a live show 24/7 at theyoungturks.com.